Hi, everybody. Welcome to the caucus discussion for the child care study to be presented and considered at the 2023 League of Women Voters Virginia Convention this weekend. This is the fourth and final caucus discussion to consider. The study is up for consideration this year. Really appreciate those who are joining now. Going to give it a couple more minutes for folks to hop on, but wanted to take this opportunity to thank the Child Care Issue Group for the incredible work over the past couple of years. It's been a long journey since our proposed study was considered and approved at the 2021 convention, and over these past 2 years we have researched, we have read, we have consulted, we have written and engaged with all of you in the local leagues to consider the 10 consensus questions that we posed, and I'll be sharing more about what the feedback that we got back from those considerations and those questions and how we incorporated that into an updated study, an updated position. So again, I'm Maria Pozzi. I chair the Child Care Issue Group for the League. The cutie you see in my background is actually my daughter, who was born in the middle of this study last October. And so child care is a very real and very personal priority for me, as baby here joins 2 older brothers, 6 and under, to really experience firsthand what childcare is like here in Virginia, and seeing lots of opportunities for how to make it stronger. So that's just a little bit of an introduction. Shout out and also gratitude to Carolyn Kaywood, who I see is on the line now, for all of her great support and guidance along the way. And as other members of the Child Care Issue Group log on, we'll be sure to acknowledge and thank them as well. But I'm going to get started with the presentation for today. So I'm going to share my screen. Can everybody see it? Yeah, okay, I'm seeing some nods. Excellent. So over the next hour, I'm going to share a refresher on why we did this study and how it was designed. I'm going to share the top level findings of our study and the consensus questions that we posed to local leagues. I'm going to share the actual position that we are bringing to the convention for review this weekend, and then hopefully leave some time, or definitely leave some time for questions from all of you. So let's get started on why we felt that this study was needed and why we put in a request in 2021. The main reason being simply that the current position in Virginia's position for action on child care does not reflect present day. It was created in the mid-'80s and responded to the issues of the time, which were largely around health and safety, prevalence of cases of abuse and neglect in unregulated care settings, and really wanting to address and professionalize the child care industry through rules and regulations and licensing. And that was a very important first step in drawing some more intention for the child care sector. Today's issues remain around health and safety, but in addition, we face issues around accessibility, affordability, the actual business model of child care connected to the low pay of the administrators and workers, inequitable access across geographic and demographics. And so we felt the need for the study to really reflect those present day issues. We also recognize the great value and importance and position that the League of Women Voters Virginia can play in this advocacy space. There is increasing attention and acknowledgement of the importance that childcare has, not just to the families, to enable the parents, especially women, to work, which they can't do if they don't have childcare, but also on the brain science and the development of children themselves and the benefits that can be gained from a high quality early education and care setting. And so really seeing the value that League of Women Voters can play in advocating for laws, rules, and regulations that enable the childcare sector in those fronts. So that's why we did it. And thankfully, the whole league at the 2021 convention agreed with that rationale and approved the issue group to conduct its study. So then the vision that we set out and the guiding principles that we have kept to throughout these 2 years is to figure out what it would take to create a childcare system where every parent, especially Black and minority parents, are free of having to choose between keeping or getting promoted in a job or caring for their child. And that every childcare provider is able to provide both quality care while remaining operational, so that their business approach and model is not so that they have to compromise quality of instruction. And that every young child has a healthy, safe place to go. Young children defined as 0 through 5 or until they start kindergarten. So that includes both infant care and toddler care and preschool. And that also school-age children up to the age of 12 have a safe, nurturing place to go. And it felt really important to include school-age children because a lot of time the discussions around childcare focus on, babies or toddlers or preschool. And we forget that 7 and 8-year-olds, even 10-year-olds, they are not adults. They're not able to come home to an empty house and spend time alone after school. They need somewhere safe to be and can benefit greatly from continued learning and enrichment programs after school. So those 3 stakeholder groups were the focus of our research. And the research happened in 3 stages. We started out through an exploratory phase where we consulted over 30 different source documents, synthesized into a comprehensive literature review led by Beth Carriel, who I see has joined us now. So welcome, Beth. Thank you so much for your great partnership in this work. We interviewed 41 community early education officials, providers, and parents. We looked at cost analysis, and we referenced other leagues' positions on childcare to get a sense of what other leagues were doing. And then we took all of that information and we brainstormed different solutions, synthesizing them together, weighing the pros and cons of, if you invest money here, what happens to quality and access over there. And all of that was synthesized into a 20-page report that included 44 unique citations and 5 attachments. And based on that report, we shared that with all of the local leagues and distilled 10 consensus questions. 13 local leagues considered those questions and got back to us with their feedback. Spoiler alert, there was a lot of consensus for a lot of things, and there were also some really good comments and feedback that I will get to a little bit later on. And so when we got all of that good feedback, we synthesized that into a proposed updated position, building off of the original position, but really incorporating many more of these dimensions that had not previously been included. And we are now ready to take this revised position. I believe it has already been incorporated into the convention materials. If it hasn't already, it will be put on our website for all to consider. So that is where we're at now. And that nicely transitions us into the actual findings and consensus questions. And I'm hoping that most folks on the call today were able to participate in the local league discussions that considered these questions, but just in case we have some folks who haven't, who are either on the call today or listening to this recording, I'm going to walk through the findings and the consensus questions again. So the study and the consensus questions organized the considerations for the different stakeholder groups around these four elements: accessibility, quality, affordability, and health and safety. And equity being sort of the overlay intersecting with all of them, because within quality, there were equity considerations. Within health and safety, there are equity considerations. Within affordability, there are equity considerations, etc. So that is how we viewed each of the areas for the stakeholder groups. And these were the findings, that these were the questions that were ultimately posed to the league. So for parents, we, realized that, or we came to the conclusion that they desperately need greater access to affordable care options. And some of the policy solutions and policy ideas that came out of the research included looking at co-payments or fees. And so the question was, should the local League of Virginia support and advocate for policies that cap the amount of pay, which we later learned should really be the amount of fees that Virginia families should pay. And that included putting an overall cap of income on families or updating the Virginia code. So that was kind of a solution for making things more affordable by limiting how much families had to pay. We also understood that even if parents can afford to pay for childcare, if there isn't childcare available, if there isn't access, then childcare still won't work and families still won't benefit. And so the second question was about ensuring sufficient supply through direct assistance to providers. We also wanted to diversify supply, recognizing that families have different needs and different preferences. Some families may be comfortable putting their newborn into a care center with 20 other babies, and other families may really prefer a smaller setting. And so increasing options, increasing hours of available care. Many families work irregular hours, and ensuring that there is care available to meet the needs of diverse families, and that care is culturally appropriate for families that, for example, don't speak English as a first language at home and may have learning or neurodivergent children that need special care. For child care providers, we again looked at directly funding providers through direct support as compared to subsidy reimbursement rates. So in the previous example, we looked at when providers serve low-income families, a portion of that gets reimbursed by the state through a subsidy. This example in question number 4 was about directly funding providers and providing financial support to providers, irrespective of the number of or disconnected from the number of children of low-income families that they serve. We then asked a question about collaborating with the workforce development to try to address some of the shortages and lack of trained licensed professionals. For young children, we asked a question about establishing universal pre-K. And this wasn't a question on whether we should advocate for this, because the League of Women Voters United States National includes pre-K in their definition of public education. So in their position on education, they include preschool as something that should be free and fairly accessible to all. So de facto, the League of Women Voters Virginia falls under that position. And so we do support universal preschool. The question is, how should that be funded and how should that be provided? Does preschool, should we fund it with state funds, even if the federal government does not fund it? And should it be incorporated into the K-12 system, or should it be, as it is right now in Virginia, run as a mixed methods approach, where various institutions can offer preschool and not just public schools? We asked a question about licensing. Right now, there are several entities in Virginia that are exempt from licensing, including religious early care settings and preschools. And our research found certain risks with that, and asked the local leagues whether they agree that all entities should be licensed. And then again, intersecting with equity, we asked the question on whether the League of Women Voters Virginia should emphasize the diversity, equity, inclusion considerations in early education assessments, curriculum design, education, training, and professional development, essentially ensuring that the quality of instruction and the approach to instruction meets different children's learning needs and positionalities. And then finally, for school-age children, this is again often the forgotten component to discussions about childcare. And there's a group in Virginia called VPOS, which is the Virginia Partnership for Out of School Time. And they were so excited to talk with us because nobody has, they feel like a lot of attention, a lot of emphasis is put on early care, is put on preschool, and really they felt like they were sort of trying to bang their drum and say, what about out of school time? What about summer, right? Like even kids that are in school, kindergarten, first grade, they have summers off, parents are working, then what, right? And so really excited they were really excited to see us include that in our study and in our updated position to make after school programs, out of school time programs more accessible and affordable. There is less research and less evidence to draw from on what that looks like. And so you'll see lots of different ideas here as possibilities, because there isn't yet, sort of the intentionality nationwide on what this should look like. There isn't sort of a lot to draw from, because in many states it's a mixed approach, and to be honest, there often isn't public investment in it. it's very inequitable in terms of access, and whether you have or whether you can or cannot afford it as a family determines whether you can access it. So again, wanting to increase accessibility and affordability as well as program quality and equity. And again, there isn't nearly the same amount of rigor and standards applied to out-of-school time programs as there is to, early care and education programs. And that's for understandable reasons, because programs look so different, right? But VPOS does have a set of sort of guiding principles and standards that they have proposed. And right now, those are just, guidelines that our programs can choose to adopt or not. And we do see benefit in having a little bit more rigor in terms of ensuring that out-of-school time programs, after-school programs have a bit more adherence to standards. All right, so these were the 10 questions that we posed. I'm about to reveal the results. Are you ready? We're going to show you, when posing these questions, what the local leagues came back with. There it is. These were the results from local leagues. You'll see the total count at the bottom is the total number of guesses. So we had 13 leagues give us responses to each of the 10 questions, and you will see there was overwhelming yes consensus on most of these questions. For the yeses that are starred, that meant that there were comments. And we took those comments seriously. We didn't just see a yes and then, feel affirmed, but if local leagues offered comments, then we took those seriously and we reflected on them, and we thought about how to incorporate them into the final position. In the instances where we saw no, which were generally around the question on affordability and the question on sustainability, there were two kind of big concerns that local leagues had. And I'll go into those here in a little bit, because even though we got some no's, we felt like addressing the reasons for those no's would allow us to still include the overall spirit of the question, rather than just dismissing it outright. And because there was still overwhelming yes, even for question 1, question 4, and question 11, we felt affirmed in that spirit of the questions, even if not all leagues agreed. So let's look at some of the specific feedback that we got. There was a big question in the question on affordability for parents. So that was one on not wanting childcare to be completely free for everybody, that there should still be some scale where the highest earners pay something. There was also some reflection on not wanting to put a number into the percent of income that a parent should have to pay in fee. That particular sort of recommendation got a bit of pushback. And so we ended up writing the position, not stating, not assigning ourselves to a particular percent of a family's income as a max for child care costs. And we clarified also that the highest earning families should still contribute. We removed any reference to mixed delivery, because that implies public funds going to private institutions, and it is a League of Women Virginia principle that we don't want to divert investments in public education to private institutions. This, I think, matters most when we're talking about preschool, right? Because that is a school. We didn't get the sense from any local leagues that they're saying that babies, like infants, need to go to school, right? That infant care needs to be publicly delivered. And so there was an acknowledgement that we still support diverse providers for, you know, infants and toddlers, but specifically for preschool, we want that to be public in the sense, in the same way that K-12 education is public. And so we heard that and we incorporated that into our updated position. We also clarified that support offered directly to providers needs to be tied to quality and should primarily be spent on raising teacher pay. There was a real acknowledgement that if we're going to invest more funding into centers to care for infants and toddlers and into out-of-school programs, then that should not go to lining the pockets of owners. It should go to staff salaries. And so we made that explicit again in the study. So having now shared everything that we did and all the things that we considered, I'm sure you're dying to know what is the actual position. So here it is, going to be the big reveal. This is the proposed new position in brief. And Beth, since you're on the line, oh wait, did you step away? I was going to invite you to read it. Carolyn, you've also been an ally. Can you read the brief position for us, Carolyn?
You want me to read it aloud?
Yes, please.
Okay. Support for state policies that promote quality childcare that is affordable, accessible, and equitable. In particular, there should be a period after equitable.
Yes.
In particular, we support policies that ensure that all young children 0 to 5 receive safe, high-quality education and care consistent with their cultural and developmental needs, that all school-age children, 6 to 12, have a safe, nurturing place to go after school until they can look after themselves, that all parents, especially minority and low-income parents, have access to affordable childcare while they work, and that quality childcare providers can remain operational.
Yay. Thank you so much, Carolyn. So this is the high-level summary of the brief. You will see it directly mirrors the intention of this study, and it sets the frame of mind and the position in which we encourage the League of Women Voters Virginia to approach questions about childcare for the next 20 years, because we are cognizant of the fact that, you know, this position will likely not get updated once approved now for another 20, 30 years. And we wanted to make sure that it stood the test of time. And so setting this broad intention, without getting into too specific policies at this summary level, we feel sets us up for success to have a strong foundation on which to stand and advocate. All right, so then this would be the brief, and then the details would go into each stakeholder group. So similar to the design of the study, we are, and the consensus questions, we are organizing this by stakeholder, considering those different elements of affordability, accessibility, health and safety, and quality. So for parents, we encourage the state to provide a number of things. The text that is highlighted in blue are leftovers from the old position. We tried to build on the existing position as much as possible, and so where there was language that we felt still resonated, we incorporated that into this updated position. And there is a version that is redlined of the updated position that explicitly calls out, which areas are from the existing positions and which pieces would be new. And then there's a clean version. So for parents, we recommend that the state should provide, let's see. Beth, if you're here now, can you read this part to us?
Sure. For parents, the state should provide some form of financial assistance that caps family expenditures for childcare at the level defined as affordable. 2, funding and support to family childcare homes, community-based centers, and other providers to ensure sufficient supply of childcare in all areas of the state. 3, funding, incentives, and guidance that enable local jurisdictions and licensed providers to meet different parents' childcare needs. 4, education to parents about quality childcare in ways that are accessible regardless of location, language, or culture. 5, tax relief to parents. 6, incentives to employers offering childcare benefits to employees and matching local funds for those jurisdictions which help fund childcare.
Thank you, Beth. So this was part of the existing study, and it also actually came up in our local league feedback as, sort of a, what about employers? Have you considered their role in all of this? And so we hadn't dug super deep into that in our study, in part because it was already part of our position. And so we were happy to build on that and keep that part of this study here. All right, Beth, do you want to keep us going here for providers?
Sure. Let's see, for providers to address sustainability and viability for providers, the state should provide assistance to childcare facilities in dealing with liability insurance. 2, offer free training to caregivers and other staff. 3, increase collaboration between the state's workforce development and early childhood and care and education systems to help providers identify and train new staff. 4, fund providers using an equity-adjusted formula so that those serving families with higher social vulnerability based on income, demographics, location, English language, etc., receive higher amounts. Funds should primarily be spent on educator compensation. Continued funding should be tied to maintenance of or progress towards quality educational standards.
Right, and that last part there, again, was directly connected to the feedback that we received on the conditionalities put on those supports. All right, for young children, I'll read this one. we recommend that the state should, I like your numbering here, Beth. Let's go with that. 1, provide, together with other levels of government, free and equitable public preschool for all children. There must be no decrease in the K-12 education budget to create this program, and it must be consistent with the League of Women Voters Virginia's education position. This was another, one local league had this comment as well, that we don't want to in any way shift scarce K-12 dollars to accommodate preschool. We want to make the pie bigger. We want to, number 2, mandate that there be licensing requirements for all childcare, whether it is provided in homes or centers or other locations, and whether it is full or part-time. The only exception should be if the caregiver is providing care for their own children or those of a relative and children from one other family. This is a model that California has adopted, so we learned from them as kind of a best practice on how you can have maximum licensing while still allowing for neighbors to look after each other's children. Number 3, provide sufficient support to assist providers in becoming and remaining licensed. 4, have a role in monitoring an up-to-date listing of childcare facilities. And this list now exists. It didn't in the 1980s, but it exists now and should be maintained. 5, require that all licensed providers that receive public funds adhere to adequate standards, which should reflect those recommended by the United States Department of Health, and honor children's diversity in early education assessments, curriculum design, education, training, and professional development. And 6, ensure that children with special physical, behavioral, emotional, and language needs have the support they need to thrive. Again, building in that equity consideration. All right, Beth, take us home, our final stakeholder group.
Okay. So to ensure affordable, accessible, equitable, and quality care for school-age children aged 6 to 12, the state should, 1, strengthen data measurement and tracking of available programs to understand gaps in access. 2, fund, together with other levels of government, more after-school programs in schools, more summer programs in communities, transportation to community-based after-school programs. 3, support staff recruitment and retention efforts. It should be, I should have said it as support staff recruitment and retention efforts as compared to support staff. But 4, establish a state level child tax credit. And 5, explore the creation of a universal after-school program. 6, encourage and incentivize after-school and summer programs to adopt quality and equity standards.
Thank you, Beth. And I think we still have a couple of typos to fix in that, which we'll certainly do, but appreciate you rolling with it. All right, that is our proposed updated position, you all. We now have 20 minutes for your questions and comments and thoughts and reflections. Very curious to hear. How did that land? Did we hit the mark? What clarifications can we offer?
Looks like you answered all their questions. I have a question. Let's see. This is
Nancy.
Nancy. Could you give some examples of the what it means when it's culturally different assessment, culturally different programs? If you had children of different cultural backgrounds, can you give some examples of what that would entail? I mean, certainly if everybody has a similar background, it's different from the mainstream. I can understand that, but when you have a mix of cultures, are there some, common examples of how that works?
Yeah, absolutely. A big thing is around holidays, for example. In my son's preschool, the children, 3-year-olds, learn to understand that different people celebrate different holidays, and to embrace that and compare, what holidays do you celebrate? And specifically for my son's class, people have different heritages. We had a celebration around Hanukkah, for example. We had a celebration around Mexican Cinco de Mayo. And so that is kind of a very concrete example of what it means to be culturally aware of instruction. Acknowledging, people may come from different family compositions. Children may be growing up in households with one mother, with one father, with a mother and a father, with two mothers, with two fathers, and normalizing around that ensures that every child in a classroom feels safe to talk about their families and share about their families. Carolyn, you have your hand raised.
Yeah, another thing I'd like to mention is hair. Appropriate hair in different cultures on young children. People have been known to be really stupid about how other people think their children should appear. And so that's a point of cultural awareness too, to the extent that Senator Spruill actually carried a bill a couple of years ago in terms of public school that students' hairdos would not be a disciplinary issue.
Right. Does that answer your question, Nancy?
Yes, that's helpful. Thank you.
Judith.
I have another question. If nobody else has any, but it looks like Judith does.
Judith has her hand raised.
Oh, yeah, no, I was just going to comment that I'm very happy to see these rules apply to all facilities, because I was appalled when I read a few years ago about, the daycares run by churches don't have to follow, don't have to be licensed or regulated in any way, and that seems like a giant loophole. So,
They have some regulation that they need to adhere to, but it is all self-reported. They are not subject to the monitoring that other care centers are. And I think we agree with you that we want to see.
I just want to say that's great inclusion.
Thank you. Nancy.
Yeah, I'm just wondering if there's any bills recently that are going in the direction of any of these things, or if there are bills going in the opposite direction. I mean, what kind of climate is it when we have a position, in terms of activity on this topic?
Yeah, the good news is that Virginia got a huge influx of funding, as did every state in the country, as part of COVID relief. And so the Department of Education, which recently took over management of early care and education, which had previously lived with the Department of Social Services, quickly got to work. So Department of Education quickly got to work and redesigning their subsidy rates and their family fee structures leveraging that influx of funding. And the state legislature, through its appropriations bills, have dramatically increased the amount of funding going towards childcare in support of those increased subsidies, reduced fees, increased eligibility, which will really do a lot on the affordability question. Now, the big $1 million moment is going to be next year when those rescue funds expire. And Virginia is going to have to decide, do we then appropriate general funds to sustain that increased access, essentially? And every state is facing this, and not enough is being talked about on that. So we are going to have to really step up our game in next year's budget, or, you know, as soon as elections are done and we know who we're dealing with, we're going to have to kick into gear in terms of ensuring that those funding levels at the very least are sustained. So that, because if they don't, and all of a sudden we face a shortage in funding, then we, like many other states in the country, are going to have a massive childcare crisis on hand. So that is the biggest question. In terms of some of these other aspects around increasing access through support to the workforce system, or streamlining and supporting quality and increased licensures, there's definitely interest among the legislature to work on those things. And we have received sort of tentative interest from many lawmakers that they want to do more, and they are open to our support in those regards.
Okay, great.
Mhm.
Thank you.
Can I chime in here, Maria?
Yeah.
On that one, in answer to that question, there was pretty recent there were big events during the Northam administration. Pamela Northam was a big advocate for improving early childhood care and education. She established the Children's Cabinet and brought in several people, including a specialist who had worked in Louisiana to really improve childcare there. And so there was a big overhaul that took several years coming, and then began on July 1st, 2021, where a lot of fragmented systems were all consolidated into the Department of Education. And I won't go into more details about that now, but
Yeah,
that
I
was
think that sets the foundation, right?
That
This has been
very
something in the
recent,
making for a while,
yeah.
and which we are now, building and strengthening.
And some of the question about cultural awareness, that's one topic that is being addressed in the Department of Education. A lot of emphasis on improving curriculums and that kind of thing. So as long as there can be funding, those improvements can continue. The biggest problem is staffing. There are not enough people who choose this work, partly because of the low salary people get. But so yeah, there have been big improvements that we can build on in Virginia.
Good.
Thank you. That's a really good addition. But Judith, you want to ask another question?
Oh, it's again, just a comment, you
Yeah.
talk about the money that came through COVID, which will be running out. Well, I think we're seeing that, in a lot of different areas. You read the education report and they've got the same issues. So there's going to be a lot of things to try to work through.
Yeah.
And it doesn't seem that the current administration is, seem to be more interested in giving tax relief than maybe using some of that surplus for other things.
Yeah. Well, and the other thing I'll mention on that front is that maybe are in here because those two things are not necessarily mutually exclusive. One way to increase affordability of childcare is through a childcare tax credit. And when talking to other advocate organizations in Virginia, there's a group called Voices for Virginia Children that advocate on a number of different children related issues. Their big push in this legislature, given that, regardless of what happens with the elections in the House and Senate, we know we're going to have a Republican governor. One area of potential bipartisan support is exactly on the child care tax credit. And that can be both a continuation of a refundable credit offered for all families with children, or it can be specifically connected to child care. Both of those are options on the table, and that we know just in this last session, Senators McClellan, Evan, Barker, and Boysko already introduced and are likely to do so again. So that is, one that a low hanging fruit that the league could get in on and support right from the start.
Okay, looks like you did answer all the questions now.
All right.
Thank you so much for all your hard work.
Thank you, guys. I will drop my email into the chat for you all, and I know Deb and Joan have it as well. If there are other questions that come up, feel free to reach out. I will close us out here with a final screen share. Just again, thanking the team that worked on this study. While I certainly coordinated the process, we had many folks contributing in different ways as their time allowed from many different leagues across the state. And so wanting to leave you with that, and for the record, a great big thank you. Well,
See you all in Williamsburg.